AMH is not a fertility test, and it won't tell you how easy or how hard it is going to be for you to get pregnant. But if you went ahead and got it checked anyway, this post is for you. AMH, or anti-Müllerian hormone, is a blood test. So this is a laboratory value that you get as your result, and it gives us some sort of indicator of how many eggs you have, your egg quantity at that snapshot in time. And honestly, the way that I use this information is it gives me a gauge on how someone may respond to the process of ovarian stimulation if they're trying to freeze their eggs or undergo IVF. How many eggs do I have to work with? What kind of dosage of medication would be appropriate? What is the best protocol to use for this patient? I always say it's honestly much more helpful to me than it is to the actual patient. But what does the patient think about when they get their AMH results? They will hear me blab on and on about how it doesn't indicate the health of any given one egg that you ovulate in a given cycle or your chance of getting pregnant naturally or unassisted. But they'll probably block all of that out and go straight to Dr. Google and plug in their AMH, their age, and try to get a sense of how do I compare to other people, right? It's human nature to do that. Now, I do think it's helpful for people to have context and to understand where their results fit in with what we consider to be quote unquote normal. So I created this tool called the AMH level checker, also known as the level setter. And you can put in your AMH level in nanograms per milliliter. It's important to pay attention to units. And then you plug in your age. So let's use an example of someone in their early 30s who has an AMH level of 2.5. And let's see where this plots you on the curve. So you can see that you're actually kind of average for age. And that band actually tells you about the standard deviation. So there's obviously a lot of variation that can happen from person to person. I built this tool based on data from this published study looking at the AMH levels of 17,000 women from age 24 to 50. So this is what we call normative data, and it can be a really helpful way to understand the normality of how our AMH, our egg count, declines over time as part of our normal reproductive biology. I'm a big believer in the saying, comparison is the thief of joy. I'm definitely not advocating for people comparing their levels and fixating on things like AMH. I always reiterate that AMH does not tell you anything about your egg quality or your ability to ovulate and get pregnant, but it can be helpful. It can give you some context and help you to understand what this all means in the grand scheme of things and what this actually indicates based on your age and where you're at in your reproductive journey. It's important to remember to focus on your journey and to not get caught up in numbers, because all it takes is one healthy egg. So if you've ever had your AMH level checked, try out my tool on theluckyegg.com, my website, and let me know what you think in the comments.